In this video, I answer a question from a massage therapist from Arizona who is getting great results using myofascial release treatments, but is struggling with the wear and tear it puts on their thumbs and their hands. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This results in a significant increase in flexibility, function, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so this week's question came from a massage therapist. His name was Jeremy. He's from Arizona. He's in year 9 in a solo practice that helps people get out of pain and recover better. Question was, I love doing myofascial release treatments on my clients and have seen some amazing results using it. The issue I am running into is that the more I do it, the more my thumbs and hands are absolutely beat up. I am worried about trying to do this long term and what it'll do to my hands, but it is the best treatment tool I've ever used. How do I continue to do this great work long term without beating the hell out of my hands? Thanks for sending that question in, Jeremy. Just a quick reminder, I do love doing these type of videos. So if you have any questions you'd like me to answer, send them my way. And if I think I can help, I'll get a video out to you. The information to submit your questions is in our profile or wherever you might be consuming this video. So let's get into it. So, a couple of common myofascial release misconceptions. Number one is that a lot of people look at it. I'll put videos up and training videos like, oh, yeah, that's just pin and stretch. I do that anyway. It all looks the same. There's some issues with that. A lot of times you look at it and it looks the same, but the difference is in the details, the fine touch, the fine feel from what you see. So, why it does on the surface level look like pin and stretch, it's something a lot more in depth with a lot of different qualities and little tweaks and fine tuning here and there. Next is that when it is getting done, there's this misconception that it must hurt like hell. The client must be like in agonizing pain as they're doing it, because if you're not creating pain, you're not actually making a change in the tissue. That causes the provider to have issues, but also the client as well, because they think if it doesn't hurt, that you're not actually doing something, they're not getting their money's worth, or it's not effective. It doesn't need to hurt like hell. Next problem with myofascial release is that you have to treat it anywhere and everywhere. They teach you to treat every muscle, every insertion, every origin, every single spot in the area. So it's a lot of treatment instead of the right type of treatment. Next, I'm not going to give a lot of attention to this, but I call them the annoying PTs out there, and I call them the research nerds, where they'll ask you questions about the effectiveness of manual therapy. They'll say things like, where's your research? Or just curious, what do you think of that? The problem with them is they bash soft tissue work because they suck at it. If they were actually good at it and put the time in, they wouldn't bash it, but that's their own deep rooted ego, or I don't know what it is, some protective mechanism in there. Manual therapy does work. There isn't a lot of research out there because I'm going to be honest, the people doing research are usually doing with like third or fourth year undergrad students that might not be as good at the treatment yet. And a lot of us out there in the real world, I'm going on year 18 of doing focused soft tissue work. We're better than those people. So we don't have time to sit down and do these nonsense research articles just to pump our ego and make ourselves feel better. Now, for me, I actually came up in the ART world, also known as active release techniques. I took all those courses for years. I got a lot out of it. The thing that I always see with ART is they kind of bully people, and they've made it this idea that they are the ones who invented myofascial release. They have patents on certain things. If you say something and you're like, I'm doing this type of treatment here, they're like, you're doing ART. Are you certified in doing that? ART doesn't have anything as far as the treatment side of things patented. What they do have is patents on what are called the pain charts. So basically in their books, they have these pain areas and they say, do these protocols. That is all that they have patented. They call themselves the gold standard of soft tissue treatment. Sure, if you want to say that, that's great. They're really good at branding. But what I found with those type of treatments and when I was doing it was I was doing way too much treatment. I was beating the hell out of my body. I wasn't really knowing where to go. I was guessing a lot. Sometimes I would get it, sometimes I didn't. So I really got away from active release techniques over the years, but it was a good start and a good foundation from what I found. What I find with active release techniques too is there's not enough emphasis on like really isolating where the problem is. You treat the whole muscle instead of where the one area should be. So, proper treatment components that we really want to think about here. Number one is we just need to slow the hell down. Everyone's in a rush. They want to do all the treatment instead of just the right treatment. My mentor taught me this early in my career. He said, in order to go fast, you first must go slow. So, slow down. Next is doing tests and measurements to know where the restrictions are. Don't just simply rely on where the client's like, oh, it hurts here. And you may look at your chart and be like, okay, I'm going to treat this, this, and this, and this, a whole laundry list of stuff. And you got 60 minutes. You're going to try to get in as many muscles and treatments as possible instead of knowing exactly where the problem is. Once again, slow down again once you do the test and palpate with some intention. People just want to jump right into treatment, like slow down, palpate, feel the tissue, feel the restriction is, feel which way it goes, which way it's getting caught up, and really slow down so you can do the right treatment. Next thing is when you're treating it, you want to get proper depth first into the area, into the tissue. What I end up seeing a lot of times with people doing myofascial release, they're either too compressive or they're not compressive enough. It's somewhere in the middle. You want to get proper depth into the tissue. Once you do that, you want to back out about 10% because if you go in and you trap the tissue, it's not going to actually slide. This is what that whole idea of like pin and stretch is. You hold it down and it slides. It hurts like hell. The reason it hurts like hell is because the tissue isn't sliding. In order to break the adhesion down, the scar tissue down, free up the nerve entrapment, we need it to slide as we're applying proper depth and then eventually tension. So then we back out. So we get our depth first. We back out 10%. Then we set tension into the restriction. We don't want to be directly on it. We want to be just below it. So say I found a restriction somewhere in the muscle. I want to be about a quarter inch down, or I always say about one thumb width down, because I don't want to be right on top of it. Because if I'm on top of it, I'm going to miss half of it as I go through. So I want to get into the restriction as we go. What I want to include in here, and if you're watching this on YouTube, I'll link it up top here, is a full training video for me talking about the importance of like depth and tension and getting in there and feeling the tissue. So if you're watching on YouTube, it's linked up top. If you're watching this anywhere else, it'll be down in the description box below. But go check out that video as you go through there because it's really going to give you the idea. It's about a 7 or 8 minute video of me going through the proper components of depth, tension, backing out, and really setting yourself up for success in treatment. So next is just getting the most effective treatment without beating yourself or the client up. First is you need to instruct and show the client the motion and speed. So myofascial release basically is usually an active range of motion as you go. You get the proper depth, proper tension, and then you have the client go through a range of motion. A lot of times when we're teaching the client, we're just showing them generically maybe how to move their hand, their head, their arm, their hip, something like that. But we really need to slow down and show them. We want to get, we want that speed to kind of slowly ramp up. We don't want them to go too fast and we don't want them to go too slow because we want to get that ultimate specialized spot. I call it like the Goldilocks zone where we're going to get the most ideal treatment. Next is make sure you're feeling the tissue slide. If it's trapped, it's not good. So what I say is as you're getting in there and you're getting proper depth and tension, it should be like a gradual buildup as you go. If you feel it like pull right away, the client's like, oh, that hurts like hell. You trap the tissue, go back to the start, reset your depth, reset your tension, make sure you're feeling that tissue slide. Next is less treatment dose. If you find an area where that worst restriction is because you did the test, you did the measurements, you did the palpation, you really lined it up, you don't need to do any more than 3 to 5 treatment passes. Treatment is like a medication. You can give enough to be effective, but you don't want to over treat it. So how to keep hands and thumbs healthy, really important. Because what I find from people is when their hands and thumbs are getting beat up, a lot of times they're being too grippy. They're not using their body mechanics correctly. They're not using their leverage correctly, and they're putting a lot of force on their hands. And this is why people burn out and their hands don't stay healthy. Most important thing is this idea of like shotgun versus sniper approach. So a shotgun approach is where you treat everything. You do like a long session. You treat every single muscle that you can find some type of restriction in, and you really beat it up. You don't really know what's causing it. A sniper's where you do tests, you do measurements, you line it up, and you go in and get the one that is the worst. That's going to make the best change in the overall functioning, flexibility, and movement of the tissue. Next is body mechanics and leverage. You know, a lot of what I do is using my lats, using my chest, using my body weight, dropping into things, pulling with things, really using the whole body, not just my hands. What I do is my hands are really used to help me keep that feel and that touch in there and a little bit of depth, but most of my depth and my tension is coming from my body, from my leverages. Next is build your body into a treatment machine in the gym. So like when I work out in order to not get jacked and, bench press 1,000,000 pounds. I work out so that I'm going to be better in the treatment room. So a lot of things I do is like single arm movements. So I do like single arm press, single arm overhead carries, single arm rows, farmer's carries, things like that, setting myself into good places, lunges, squats that are going to really build up that base and allow me to use my body a lot more so I'm not beating my hands up. Next is aim for the minimal effective dose and then stop. You know, a lot of people want to do more and more treatment instead of getting it just right. I always say, think of treatment like a medication. Say someone has like an infection, they need to take an antibiotic. They're not going to take all 10 pills one day. They're going to take one at a time as they go. And a lot of times people make this mistake when they're doing musculoskeletal treatment. They think it can either make the problem better or it won't change anything. They don't realize that if they overtreat it, they can actually make the problem worse. So get the minimal effective dose and be done with it, let it heal, and then come back to it at a later date. That's all I got in the video. I appreciate you watching. Any insights you might have gotten, share them in the comment section below. I try my best to converse and talk to anyone else out there and share some other information. You could also do me a solid and share this with other providers that you know it might help. And lastly, if you like what I'm teaching, you like what I'm sharing, go download our free training modules where we take you through the full system from start to finish about what questions to ask, what tests to do, what measurements to do, what palpations to do, treatment demonstration, depth and tension, all the good stuff to really allow you to allow the hands to preserve better, get more effective treatment, and continue helping people without beating the hell out of your body. I appreciate you watching the video, and I'll catch you on the next one. Bye.